2 years ago, the Senate overwhelmingly passed legislation to expand the Children's Health Insurance Program. Overwhelmingly, massive vote, very large majorities. Regrettably, President Bush vetoed those bills. The House is unable to override the vetoes. However, a very large majority, both House and the Senate, supported passage of that legislation in 2007. The legislation we are considering today is nearly identical to those two bills.
What a difference an election makes. We have now President Obama, who is eagerly awaiting the legislation to come to his desk that would expand from 6 million to about 10 million low-income children from working families the ability to get health care. And so this is a very exciting time as we start the new session for us.
This bill is absolutely critical to children, to families, and to our economic recovery. Let's be clear, you can't help families achieve economic security without the security of health coverage. And we need to begin to do that with children.
In these tough economic times, state governments are being hit hard, and state programs for children's health are starting to run out. Now more than ever, we need to expand our efforts to make sure no child goes to bed at night without health care.
We are seeing tremendous financial burdens on our families, and reauthorizing CHIP will ensure that these children who are so in need will have critical health care coverage, and that it will cover 4 million additional kids.
Some of our colleagues may question whether we can afford more health care for our children. Well, let's look at the facts. First of all, this legislation won't cost us a dime. It's completely paid for. Second, making sure kids can get regular checkups and focus on preventive care has the potential to reduce emergency visits and save money down the line. But above all, Americans believe health care should be a national priority. Improving the health of our children is one of the most important investments we can make.
Children don't stop being sick or having illnesses just because health care is not available. So there's a sense of urgency we have. That's why our leader has placed this as a top priority for the new session, and why our new president is eagerly waiting to sign this legislation.